pulmonary embolism is basically a big word for a little blood clot in your lung, because pulmonary means lung, and then embolism means basically a blood clot that disconnected and is traveling around your body. But a blood clot is just a big ball of blood, basically, and it's moved into your lungs. So that's why it's a pulmonary embolism. So what we're going to be able to do is we're going to run some labs and tests, and we'll help explain that to you. Some tests that we're going to be able to run is a blood test. They're just going to take a little needle and just take your blood, and then they're going to run tests on it to see if they can find anything as to why you would have a pulmonary embolism in there. Then the rest is just going to be chest x-rays and an ultrasound. Those are basically two different things that you're able to take pictures of your insides so that we're able to see your insides. And then the last thing is a physical examination, and that's just going to be the normal things that you would go to for your regular doctor, where they basically take your temperature, your blood pressure, your heart rate, all of that stuff. And then some things that we would see if you would have a pulmonary embolism is an increased heart rate, and that's when your heart beats a lot faster than what it's supposed to. Other things that we would see is when we listen to your lungs with our stethoscope, we would hear crackles, which is going to sound like that Rice Krispie noise that you would hear when you pour yourself a bowl of Rice Krispies, or wheezes, and that's going to be like a high-pitched whistling sound when you breathe. And then when we look at your chest x-ray, if we would see that you have a pulmonary embolism, you would see an increased density in the picture. Your pulmonary arteries would be wider, and then there would be light areas. So here's a picture that you can look at, and you see those lighter areas. That's going to tell us that if you have a pulmonary embolism. And then the increased density shows us where it is. And then you can see your pulmonary arteries kind of there, and you can see that they're widened compared to what they're supposed to be. So then that's how we're going to figure out if you have a pulmonary embolism.